Hi everyone, so I'm back again with another interesting video, and today we'll be discussing about the basic oral hygiene methods in a child of up to 1 year of age. So most of the people, they think that a newborn or even a child of almost a year of age is too small for any basic oral hygiene method, right? No, but that's not the case. According to a general argument, it says that plaque removal activities should begin on the eruption of first milk tooth. That means when you have your first milk tooth in your mouth, that is the time when you should start with plaque removal. And what's plaque? In simplest term, you can understand plaque to be just a layer of microorganism. Okay? So some say that this should be done after you have your first milk tooth in your mouth. But then some practitioners recommend that cleaning and massaging of the gums should be done before any eruption begins, right? Like right from the time of the newborn itself. Okay, you have your newborn in your hand and you've taken him or her to home after, you can say, a week or so. When you have your baby stabilized, you can start having the oral cavity cleaning methods to be done in your newborn's mouth. Okay. Now we have this question, why? And that too, why right from the time of birth? As in, just in a case of newborn, why is it important to have an oral hygiene method? Because of two reasons. First is to establish a healthy oral flora. Okay, so the microorganisms that we have in our mouth are not always bad. You have some beneficial and healthy microorganisms also. That means those microorganisms which are native to that region, which are required in that region to have a healthy body and likewise to have a healthy mouth. So to establish that, you need to practice oral hygiene methods. And the second is it helps in teething, because all of us know that teething, that means the process of teeth coming into your mouth, it's a painful process and it's quite a complicated process. And some patients, usually they have irritation, they have loose motions, they have fevers. Okay, so it even aids in the process of teething. Now we'll cover different points as to how we are supposed to do it. So in case of really small children who cannot stand or sit on their own, the mother or the father is supposed to cradle the child in their arms, essentially in one arm. Okay, so they're supposed to hold the child in a cradle position in one arm, and the other arm should be used to clean their mouth. Okay, now this helps basically when you're cradling your child, it helps in developing a strong sense of security. And this process, if it's done once daily, it's sufficient. The time of the hour is not particular, because the child who's just born has hardly had any sleeping cycle, so to say. So can be done any time of the day, but should be done once daily. Okay, now in the case of newborn, when there's no teeth and you just have the gum pads, so in that case, what you're supposed to do is you're supposed to wrap your index finger, as is shown in this picture. You're supposed to wrap your index finger with either a gauze piece, a moistened gauze piece basically. Just rinse the gauze piece under the running water and squeeze out the entire water, and then just wrap it in your index finger, and with that you can clean the gum pads and even the tongue, because you'll see the milk residues, they are attached on the upper surface of the tongue. You can find it white, so you're supposed to clean that. Or you can also use washcloth. I suppose all the mothers must be knowing the washcloth. It's easily available in the market. It's basically a very soft cotton cloth or a hosiery cloth. So you can even wrap that around your index finger and you can use that also to clean the mouth of your child. Basically the gum pads and the tongue that needs to be cleaned. Then you can even use these silicone finger brushes to clean tongue. The benefit of this is it's quite easy to handle it, right? You need not to be that dexter. What you have to do is just insert your index finger in this thimble sort of a thing, and it has got silicone a bristle sort of a thing. It's made up of silicone, so it's very soft, and it very softly and gently removes the upper surface of the tongue, because it's quite difficult to clean it with a washcloth or a gauze piece. You'll have to apply some pressure. But with this, since it has got a very soft silicone bristle sort of a thing, it's very easy to clean the tongue, essentially, I would say. Otherwise, the gum pads can be cleaned either with this finger brush, or you can also use the washcloth or the gauze piece that I showed in the previous slide. Now, when we're discussing about cleaning the mouth, there's this general question that must be coming in your minds, that are we supposed to use a toothpaste? So, no. In such a small child, you're not supposed to use a toothpaste, because the foaming action of the toothpaste, and that foaming action is because of the detergent that's present in the toothpaste, and that foam is quite objectionable to the infant. So we are not supposed to use a toothpaste. It's not necessary, nor is it needed, okay, nor is it advised. Now, after your child has got few teeth in his or her mouth, that's usually at the age of 7 months, 8 months, 9 months. So by that time you can introduce a toothbrush. Okay. So for the toothbrush, you have to be careful that the toothbrush should be small in size. That means the head, that is the area where you have bristles in the toothbrush, that's called the head of the toothbrush. So you need to see that the head of the toothbrush is small, because obviously your child's mouth is really small right now. So the smaller will be the toothbrush, the easier will it be for the child to handle it and move it around the mouth. And the second thing is, it should have a thick handle, so that it's easier for the child to handle his or her toothbrush on her own, and for you also. Okay, so the toothbrush's head should be small, the handle should be thick, and the bristle itself should be very soft, because all of us know the child's mouth is very soft as compared to ours. Then usually by around 1 year of age, or I would say basically after 1 year of age, according to me, a non-fluoridated toothpaste can be used. It can be considered beneficial, but some people recommend it, so I've put it in here. But according to my recommendation, one should not be using any kind of dentifrice or any kind of toothpaste, be it fluoridated or non-fluoridated. It's not recommended. It's not needed at the first place. Then a very, very important aspect that I would like to discuss and create awareness about is dental home. That is, take your child to the dentist, ideally within 6 months of age, but optimally at least by the age of 1 year. Why is it important? See, it's important because you might not know something, or you might feel that it's normal, but that might not be the case. There might be some abnormality. And if you take the child to the dentist, because the dentist is all learned and is all experienced in knowing such stuff, he or she will let you know that if there's any problem or if there's any abnormality in your child's mouth. So he'll make you aware of it. Then he can even see the ongoing teething process, if it's fine or there's any variation, or if you need to worry about anything. And also if there's any preventive way of something that can happen in that age group, but if you adapt those preventive ways, it can be forbidden. So he or she can even teach you that. He or she, that is your dentist, might even let you know ways of how to intervene in any problem. Like for example, these pictures that I've attached. You see, these are some problems that are present right from the time of birth, or you might have the yellow teeth erupting in your child's mouth, and you must be thinking that this is how teeth are, right? Until and unless you are actually made aware of the fact that no, this yellowness is because of some problem. There's some problem in your enamel, like amelogenesis imperfecta's photo that I've pasted here, or you have early childhood caries. That's also because of some reason. You might be not knowing something, and because of which this is happening. So he'll let you know that why is this happening. Okay, you might have dentinogenesis imperfecta. That means you might have some problem in the dentine. Okay, so dentine, enamel, these are all hard layers of the tooth. So you might be doing everything right, but this problem might be present right from the time of birth, or maybe when the teeth was being formed inside your womb, and you might not be knowing about it. So the early visit of the child to the dentist lets the parent know if there's any problem, or if there's any morphological defect. As I had mentioned this before in my, I think, the first video. So, morphological defect, I'll repeat that again. It's basically any defect in the shape of the tooth structure. As you can see, you have a mulberry shaped tooth here. So, this tooth is not like this normally. And because this is mulberry shaped, it has got a lot of grooves, it's got a lot of pits, right? So, it's easier for the microorganisms to go and hide in there. So, all this can be corrected, all this can be made aware of to the parents, and then you can help your child. So that's it. That's it for today. And I hope you like my videos. I hope you are able to understand what I'm trying to convey. And my entire idea behind this is to create awareness between children's parents, essentially. Because I see that the parents are really not aware of the oral health even now. And if there's anything else that I can help you with, do let me know. I'll be more than happy. Thank you so much.